Okay, welcome everyone. Thanks for joining us today. Today, KFL&A Public Health is hosting a panel call about questions asked by parents in our local community about COVID-19 vaccine safety for children ages 5 to 11. And we've gathered some of our great experts in our community to join us today to answer those questions. So today we're going to start just by introducing Dr. Oglaza. Hello, Dr. Oglaza.
Hello, my name is Peter Oglaza. I'm the Medical Officer of Health at Kingston, Frontenac, Lennox, and Addington.
And we also have Dr. Van Wylik. Hello, Dr. Van Wylik.
Hi, yes, I'm a pediatrician at Kingston Health Sciences Center in Queen's University.
Thank you. And then we have Dr. Pincock. Hello, Dr. Pincock.
Good morning. I'm Robert Pincock. I'm a family physician with the Belleville Queens Family Health Team.
Thank you, Dr. Pincock. And next we have Jen Baker. Hi, Jen.
Hi, thanks for having me. I'm Jen Baker. I'm a pharmacist at Loyalist Pharmacy in Amherst Pugh and the Lennox and Addington County General Hospital.
Thanks, Jen. And last we have Dr. Lifeso. Hi, Dr. Lifeso.
Hi, I'm Dr. Kirk Lifeso. I'm a pediatric infectious diseases physician here at Kingston Health Sciences Center.
Okay, that's great. Thanks everybody for joining us again. So we're just going to jump right into the questions that we've received from our community and parents. And we're going to start today with a question for Dr. Lifeso. Why should my child get the COVID-19 vaccine?
Yeah, so this is a great and common question. And I think we'd start with just by saying that the vast majority of side effects from the vaccine are mild and consistent with the side effects seen in other vaccines that we routinely give to children. So when we weigh that against the points coming up, it's likely that there's more benefit than harm for the vast majority of children who would receive the vaccine. So first, severe disease is rare in children, but it does occur. So preventing severe disease is, even in a small number of children, is really important and something to aspire to. There are post-infectious problems, such as a multi-system inflammatory syndrome, which can happen weeks after an infection, and that can be severe and cause hospitalization as well too. So preventing those post-infectious complications is a plus. Many children have close friends or live with family members who have medical conditions themselves. And so preventing infection in the child and protecting those loved ones around them is really important and may be very important to those children as well, too. And finally, preventing illness that keeps a child at home and away from the activities that they love and that are important for their growth and development is also a very important thing to do. So being able to stay in school and keep up with their activities is a great reason to vaccinate a child. And so there's, I think, lots of good reasons why children should get the COVID-19 vaccine when it becomes available.
Okay, thanks, Dr. Lifeso. Our next question is for Dr. Pincock. What side effects can my child expect after receiving the COVID-19 vaccine?
Yeah, this is a really common question. So common vaccine side effects include a sore arm, a mild headache, aches and pains, and sometimes maybe feeling tired or a low fever. Lots of people don't actually have any side effects at all, and that doesn't mean that the vaccine isn't working. The side effects, if you do get them, might last for a few hours or a few days. The severe side effects are very rare, and the pediatric dose of this vaccine is actually at a lower concentration than the adult dose was. So it might actually reduce the incidence of having side effects in this population.
Okay, thanks, Dr. Pincock. Next question we have is for Jen. My child is anxious to get the shot. How can I ease their anxiety?
Yeah, this is a great question because a lot of children experience anxiety around immunizations, and there's some really good practical tactics that parents can use to help make the experience an easier one and reduce anxiety for immunization in the future. And this works not just for the COVID-19 vaccines, but for all vaccination appointments in general. So really the first big thing that you can do as a parent is really focus on good communication around immunization for your child. You can share your own experience when you got your vaccine, emphasizing things like the needle itself is small and does not hurt a lot. Saying that it doesn't hurt often isn't helpful because there is a small amount of pain that goes with the injection. And if you tell the child it won't hurt, they may lose trust in that for the future. So just emphasizing that it doesn't hurt a lot. In my practice, I use practical examples like it feels a little bit more than a mosquito bite, but definitely a lot less than a bee sting to help the child sort of conceptualize what to expect, and that can reduce the anxiety. It's also important to talk to your child and validate their feelings before receiving the vaccine, but still stress that it's important to get the vaccine to protect not only themselves, but to protect their friends, their loved ones, and talk about really how what a great thing it is that they're doing by reducing the risk of transmission of COVID by protecting themselves, which protects everyone around them. A big thing for parents is to stay calm yourself. Children are like little sponges. They can pick up on your energy. So if you're feeling very anxious about the appointment, that can transfer to them quite easily. So just try to schedule your appointment for a time when you're not going to be rushing from point A to point B, so you're not stressed about getting somewhere or being late. Try to keep yourself calm and not prejudge what your child's reaction to getting vaccinated is going to be. Be comforting and supportive, but really by staying calm yourself, that calm will transfer to your child. When your child's getting vaccinated, it's really important to keep the limb that's being vaccinated immobile, so keeping it still to reduce any sort of pain that would come from movement during the injection. So there are different ways if your child is going to be sitting on your lap that you can use different holds in order to keep those limbs secure, but also provide comfort to the child. There's a comforting hug position where you hold the arms immobile, or if they're younger, you can use the cuddle position. You can find diagrams of those positioning on Immunize Canada, as well as talk to your immunizer at the appointment about what the best way to hold your child is during the appointment itself. And really helping your child relax and distract themselves during the appointment helps a great deal. So helping your child breathe calmly, if meditation or mindfulness is something that you do in your family, helping your child do that throughout the appointment. Or distractions really are fantastic. Now might be the time for some screen time with a favorite video, pictures of a family pet, things like a song, favorite toy, funny stories, anything that will help distract the child from what's going on and not focus on the injection itself. Before the injection appointment, there's also some good resources in books or TV shows that explain the process of getting an injection and can help the child understand the process. And there are some strategies that you can use to reduce the pain of the actual injection itself. You can talk to your child's doctor or pharmacist about what can be done. Things like numbing patches or numbing creams prior to the appointment can reduce pain. And just knowing that they have that on can really relax some children, knowing that they have something that will help them throughout. So it really comes down to just trying to make it a calm and pleasant experience as possible and staying calm yourself as a parent.
Okay, thanks for that great information, Jen. Our next question is for Dr. Van Wylik. Does my child need the vaccine if they've already had COVID-19?
So the answer is yes. Having had a previous infection will, of course, produce an immune response, but we don't know how long that protection is actually going to last, and it may, in fact, wane. We know that vaccination boosts that response and it provides probably longer protection. And this virus, like lots of viruses, likes to change a bit over time, and we think that vaccination provides a longer response. Families may have experience with other childhood infections where they've had the primary infection that provides a longer term response and protection to a future infection. But we don't know that's the case with this virus. So vaccination definitely is a good way to go.
Okay, thanks, Dr. Van Wylik. Next question is for Dr. Lifeso. Will the vaccine change my child's genetics or cause infertility?
Yeah, no, it won't. So the mRNA vaccine that we were talking about provides the instructions for the cell it's delivered to produce the spike protein, that thing that you want to train your immune system to recognize so that you can fight off the disease when you see it. That mRNA goes into the cell, and the cell machinery produces the spike protein, but it never makes it into the nucleus, which is where the DNA is stored. And so it's never integrated into the DNA at all. And that mRNA breaks down within a couple of days of injection. So it doesn't stick around at all. The spike protein, that training protein for your body does stick around. It can stick around for several weeks, but then it disappears. And that's what you want is it to be there to give your body something to recognize and train the immune system against. With respect to fertility, there is no evidence that any vaccine, including the COVID-19 vaccine, affect fertility. This has been looked at in adults, and there's no evidence there either in men or males or in females that there's any effect on fertility, either in the short term or the long term.
Okay, thanks, Dr. Lifeso. Next question is for Jen. Do I have to worry about any long-term effects of the COVID-19 vaccine?
This is another great question. So medical professionals and scientists are confident in the long-term safety of the COVID-19 vaccines for several reasons. And in fact, we're so confident that the vast majority of us are going to be immunizing our children as soon as they are eligible. So first, this is not new vaccine technology. Scientists have been studying and working on mRNA vaccines for decades, including vaccines for flu, for Zika virus, for rabies, for CMV, and actually for different cancer treatments as well. So decades of studying mRNA, which is a naturally occurring nucleic acid sequence in our own body that we consistently produce and degrade every single day, has shown that there are no long-term side effects. Secondly, the negative effects of a vaccine generally occur within 6 weeks of receiving the vaccine itself. And regulators in many countries around the world require at least 8 weeks of safety data in order for regulatory approval of a vaccine. The vaccines have now been in use for many months with billions of doses administered around the world. In fact, this may be the most widely used medical product around the world, even more so than most common medications. So we have lots of safety data from the use in these other populations. Third, we're very confident in the track record of Canada's vaccine approval and safety monitoring system. This means that the end data and safety tests for COVID-19 vaccines are the same as other vaccines that have been approved in Canada over the last several decades. Canada's system has proven time and time again that the data necessary to get the approval process is rigorous enough and sufficient enough to prove safety even in the long term. So when considering the long-term risks, a COVID-19 infection itself is much more serious of a concern for your child. The virus can cause long-term damage to lungs and other organs, which has been discussed in the previous questions, and may have many other complications. And this, we may also be concerned about post-COVID-19 syndrome or long COVID and those effects in our children. And it's one of the reasons why doctors recommend getting vaccinated. And making a choice for your child can feel very daunting and scary in this time. And I think it's just important to remember that any choice we make around vaccination is a choice in and of itself. If we choose to get vaccinated as soon as we're eligible, that's a choice, as is a choice to wait. And the risks that come with that of having a COVID-19 infection itself, or the risks of not getting vaccinated at all. So if you do have any concerns, definitely talk to your medical professional about what your concerns are and get those answered so that you can make the best choice for yourself and your family.
Thanks very much, Jen. The next question is for Dr. Pincock. What about myocarditis or pericarditis? Should I be concerned?
Yeah, that's a really good question. A lot of people have had concerns about myocarditis and pericarditis based on the experiences of people in older age groups. The good news is that in the 3 months of monitoring that's been done with the Pfizer vaccine, there have been 0 cases of myocarditis or pericarditis in the 5 to 11 age group. As well, the vaccine for the 5 to 11-year-old age group is of a lower concentration, and that might also reduce the risk of myocarditis and pericarditis in this age group.
Okay, thanks, Dr. Pincock. Our next question is for Dr. Van Wylik. If a child has medical issues, is it safe to get them vaccinated?
So as a pediatrician, my practice is all about children with complex, chronic, and acute medical problems, things, like ADHD, autism, heart, lung, kidney problems, neurologic problems, other developmental problems. And I would absolutely recommend the vaccine to all of them. The reality is that children with chronic health conditions are probably at increased risk of complications and severe outcomes from any infection, including COVID-19. And vaccination is an effective way to prevent those complications. So I think it's especially important that kids with chronic medical conditions get vaccinated. One area that families may be worried about is allergy and what that means for their ability to get vaccinated. And I would really encourage people to not just think that allergy precludes them from getting vaccinated, but in fact to have a conversation with their healthcare provider so that they can understand what it really means for them. Most children with allergy can in fact be vaccinated with this vaccine. And there are ways to figure out if it really is a risk for your child beyond just a conversation, perhaps even consultation with an allergist. So I think to summarize, I think kids who have chronic or acute medical problems really should be vaccinated to have the best protection.
Okay, thanks, Dr. Van Wylik. Next question we have is for Jen. Will children need booster shots of COVID-19 vaccine?
This one is hard to answer because we don't know just yet. Approval has been submitted right now for a 2-shot series for kids. And like adults, the third dose or booster situation will be decided in the months to come. Once a vaccine starts being in use, there's still lots of post-approval surveillance that happens where we determine, what is necessary moving forward based off of the epidemiological data that comes in around COVID-19 infection. So stay tuned, because as we all know more about the need for a potential booster, we'll communicate that as soon as it's available.
Okay, thanks, Jen. Our next question is for Dr. Oglaza. What if my child doesn't have ID or an OHIP health card? Can they still get vaccinated?
Yes, absolutely. COVID-19 vaccines are publicly funded in Ontario for all Ontarians, and we want to make sure that family not having an OHIP card or an ID for the child, that is not a barrier to provide that protection immunizations for the children. So if you're in that situation that you don't have a valid OHIP card or ID for the child, please do call ahead and inquire at the clinic that you're planning to bring the child for immunization. And if you don't have that opportunity, raise that with staff at the clinic as soon as you arrive, and we'll make sure that that this is addressed and that your child will be able to receive that vaccine.
Okay, thanks, Dr. Oglaza. Thanks very much for joining us today. More information on vaccine can be found on our website, kflaph.ca/vaccine. And booking links will also be available on our website once provincial eligibility opens up. Thanks.